understand how menstrual blood-derived stem cells can create a less invasive approach to stem cell collection and therapy and help feed the human body. So for centuries, diseases that affect women specifically have been overlooked and minimized. In a world where every human being is birthed from uterus, it is astounding that women are devalued and excluded. This research aims to uplift, empower, and encourage women to understand how incredible we are. So let's talk about stem cells. Stem cells are undifferentiated cells that have the capability to differentiate, meaning to change or transform into a new cell, and proliferate, meaning to replicate into almost any cell in the human body via cell-to-cell communication. Most cells begin as stem cells and transform to any cell that's needed in that time and place. This is essential for cells that are old, dying, compromised, diseased. With this ability, stem cells can regenerate tissues to support optimal function of the human body. So this is an example of, in this case, menstrual blood-derived stem cells coming from the endometrial lining. This would be an example of a single menstrual blood-derived stem cell differentiating into a couple different, these are just a couple different examples of what they can replicate into. So muscle, fat, bone, cartilage, brain. Again, just a couple examples. So stem cells began being used in regenerative medicine in about 1950, with the first bone marrow transplantation occurring in 1956. It proved to be effective with mice being induced with leukemia, which in turn created this method being more used in the 1970s and 80s. So for the last about 70 years, and now it's the primary source of stem cells. However, it's a very painful procedure. So if you can imagine, you're going through skin, fat, through muscle, through the bone, to the middle of the bone, and grabbing that bone marrow with a needle. Painful. I'd also like to state that women and minorities were not mandated to be in research until 1993, exclusively by NIH-funded research. So my question, how can menstrual blood-derived stem cells further medical research, aid human health, and heal disease? Current methods are bone marrow, umbilical cord blood, fetal matter, fat, amniotic fluid, and amniotic epithelial tissue. These methods are either painful, invasive, or controversial. Menstrual blood-derived stem cells offer a less invasive, less controversial way of collecting stem cells. Currently, we are gathering these stem cells via a collection cup placed in the vagina, and then transplanted into mice, rat, and rabbit models. The regenerative potential has been observed in endometriosis, infertility, PCOS. These three are exclusive to those with uteruses, as well as rotator cuff injuries, heart failure, neurodegenerative diseases, stroke, liver function, and pancreatic function. So again, here's an image of their female reproductive system. So this is the uterus, cervix, vagina. These stem cells are collected during menstruation, flow through the cervix into the vagina and a collection cup. That blood is then separated into blood and plasma, and then continue to be spun, cleaned, until you just have those stem cells, and then they're transplanted into models. Overall, menstrual blood-derived stem cells is an effective source for stem cells. They do not cause tumors, they don't trigger an immune response, ability to self-replicate, don't cause cell death, and blood vessel formation to that new tissue occurs. There are exceptions, so the age of the donor and the number of passages can have a negative effect on menstrual blood-derived stem cells. Donors over the age of 40 saw negative effects after passage 15, and I'll explain what a passage is in just a moment. While donors under the age of 40 did not see negative effects until passage number 27. However, proliferation remains stable throughout all the age ranges, which is incredible, and it's better than bone marrow-derived stem cells. So this would be an example of a passage. So the stem cells are taken from the uterus, they're spun, they're separated, cleaned, and then they're placed on a plate with agar, which is basically food and home to these stem cells. They divide, those stem cells are then transferred to a new plate. That would be considered passage one. Again, some of those stem cells are taken from one plate into another plate, that would be passage 2, so on and so forth. So we've seen this go from passage 15 to passage 27. This is over months. It's really incredible that these stem cells are able to continue to replicate after so much time. So we've seen that in vivo is more effective, which is to be expected. In vivo is within an organism, in vitro is outside of an organism. So we find stem cells inside of an organism, so it's expected that they would thrive more. The immune response was regulated by CD45, CD4, and CD8. This is crucial. This indicates that menstrual blood-derived stem cells can integrate into a new host without triggering an immune response. So social implications. This is great for diagnostic tools, preventative measures, regenerative technologies. However, there's health disparities as we see in the United States. Those who have more money, who have better health insurance, have access to greater health care. And it protecting patients, so keeping transparency in the doctor's office is so crucial. There's gender-based harm that could be a potential, and I think that healthcare could do a much better job at reducing waste. So I'd like to end by saying, in a patriarchal society, I think it is so important for women to understand how powerful and needed we are for the well-being of humanity. Using menstrual blood-derived stem cells, we have the capability to collect stem cells from one uterus and heal another uterus. That's incredible. This includes infertility, endometriosis, PCOS, 3 of the least studied disorders. Why? Because they happen to women. References, I'd like to thank my McNair cohort. Thank you, Dr. McNair. Thank you, Dr. Paliava. Thank you, Dr. Delise, Darius, Marta, and my amazing mentor, Dr. Fuller. Thank you so much.
Due to time, we have time, just one question.
Just hoping so I understand exactly, the stem cells from menstrual fluid can turn into any cells in the body, or just ones related to the reproductive system?
Almost any cell in the human body. There's exceptions. Red blood cells would be an exception because they're formed differently. They're just an exception. But pretty much any cell in the human body, these menstrual blood-derived stem cells can become.
Right, so they do basically everything the bone marrow stem
Yes.
cells do.
And that's
I can't believe this hasn't been studied more before.
yeah.
Yeah, that's awesome.